This segment sponsored by SuperShot. SuperShot's mission is to promote vaccination and provide access to immunization community-wide. They believe that vaccines save lives, but misinformation and confusion are making it harder for families to know what to trust. So today we're going to dive deeper into the vaccines that they offer and also learn about their newest PSA. And joining me today is Connie Heflin, who is their executive director, and Dr. Tony GiaQuinta, who is the pediatric physician at Parkview Health. Good morning.
Good morning.
Welcome to you both.
Thank you.
Okay, so this is a hot topic.
Sure.
This is a hot topic. It is vaccines, and just right now, there's just confusion. You know, I would say, and parents are like, what do I do? What do I do? So talk about the messaging about vaccinations right now, doctor.
Well, it's super natural for parents to have questions about lots of medical topics, and vaccines are no exception. We never, as physicians, want vaccines to be a taboo subject where they feel like they can't talk to us about whether they're safe, how effective they are, just like they would come and talk to us about fevers or car seats. We're here for you, and that was really the message we want to get out to the public, is that it's your pediatricians. We are the doctors that you go to for common health topics, and we don't want immunizations to be any different from any of those things.
Yes, and you see a lot of it being the medical director at SuperShot. And so with this PSA, Connie, let's talk about that a bit, because you all are just really focused on providing just this new message that you want this community to help kind of push it out, right?
Right. So we have the three main healthcare systems, Parkview, IU Health, and Lutheran, and then we have the two main pediatric groups, Pediatric Associates and Fort Wayne Pediatrics, and the Health Department and SuperShot, all coming together to speak with one voice. Talk to your doctor about vaccines. They're safe and effective, and if you have questions, just ask those questions, because it's so important to get the information. It's so important to protect our children against these vaccine preventable diseases. And the science hasn't changed, but the messaging has. And we understand that's causing a lot of confusion. So just really take that time, and if you are confused, talk to your trusted doctor. They have been there for you from day one, and they're still here for you. And so it's just a united front to say, talk to your doctor about vaccines.
Exactly. And so let's talk about SuperShot for a moment. In case people don't really realize what you all do in the community, you provide these vaccinations, correct?
We do. So SuperShot is a Fort Wayne-based nonprofit. We've been here for over 35 years, and we're here to break down those barriers of access and affordability to vaccines. So regardless of what type of insurance you have, or if you don't have insurance, we will see everybody in the community, children and adults, and we don't want cost to be a barrier. We also do a lot when it comes to bringing community partners together and providing education. So right now we really thought it was important to bring our community together. We might not be able to change everything that's going on at a federal level, but we can really talk about it locally with our trusted community partners and build trust locally.
Yeah, and you talked about talking to a trusted doctor. And so, Dr. Tony, I'm sure that you get a lot of questions regarding this. And it's not so much of saying like, you must get a vaccination. It's about seeing the options and saying, is it right for you and your family and what you're looking for, right?
Yeah, it's really about talking about the why, right? Why does this doctor recommend these immunizations? At the end of the day, we both want the same things, and sometimes that's where it starts. Is let's talk about a common ground. Parents, doctors, we all want that child to grow up and be a healthy, successful adult. And for vaccines, that is a critical part of that process. For me, I just want your child to be safe and protected. That's why we're going to recommend car seats and seat belts, and immunizations are no exception. We find that when your child is immunized as quickest and safest as possible, according to a schedule that makes sense, then that child is going to be earliest protected and safe from dangerous disease and infections.
Yes, absolutely. And I know that you focus on children a lot because you're a pediatric physician.
Right.
Super Shots does handle vaccinations through adulthood, correct?
Absolutely. So we see infants, right after they're born, and adults and seniors all the way through that spectrum. But it's really important. Infants really have a vigorous immunization schedule. That vaccine process starts at birth in the hospital, and then it's a 2-month, 4-month, 6-month annual visit all the way up. So it's really important for children to stay on track because, like Dr. GiaQuinta said, when you follow that recommended schedule, they are protected as early and as safely as possible. So it's like wearing a seatbelt. You never know when a child's going to be exposed to something. And when you have those immunizations and you're up to date as early as possible, you have that protection to fight against disease.
Yeah.
So, yeah.
Because it's like across the board. We say, what is it? What's better than a cure is
An ounce of
prevention.
Yeah,
Right.
very good.
Prevention.
You got it.
There it is.
Yes.
And so one thing that we're seeing right now, unfortunately, that's breaking out in a lot of areas around the United States are measles.
Yeah.
Right.
What is that about? And, that was like the main immunization I remember people being protected from. But now there's an outbreak.
Yeah, and in fact, if you just rewind the clock about 25 years, we declared measles eradicated from the United States. So this is a major setback. And again, it comes back to, boy, a lot of parents are really questioning and hesitant about the safety of measles. We know it's effective.
Right.
When our vaccine levels reach a certain threshold, we don't spread measles, which is really important so that you can go to school without fear of a dangerous disease. Or if you have a medical condition where you're immunosuppressed, you don't have the same amount of fear that dangerous virus might impact that child. So for us, it's disappointing that we're seeing measles outbreaks because we know it's preventable.
Right.
But we also need to pause and understand, okay, why is that happening? Where is that disconnect that families are choosing not to vaccinate?
Yeah.
And again, that's the big part of this PSA is let's talk about it. Come to your doctor and we can talk about the things you're hearing and learn from our experiences as doctors. I have over 3,000 kids that I take care of in this community. So that's a lot of children that I recommend vaccines for. And I have to tell you that in my experience, these vaccines are incredibly safe, way safer than a lot of the medicines in my tool bag.
Yeah.
And I want families to know that and to get that sense of confidence about it. But then also talk about the things that they're hearing about these vaccines and in terms of their safety and efficacy. And we are here to share our experience and hear from our expertise.
Yeah, because I'm sure, and it's okay to have questions. They want to know, are there
Please,
side
bring it on.
effects?
Yeah.
What's the frequency? Is this, will this harm my child? So what are some of the vaccines right now that are very important for children?
Well, goodness, I mean, that's like asking who my favorite child is, Margaret and Henry. So I won't get into that as so much because, gosh, it's almost asking which illness would I be okay with my child getting?
Because as a child, you were saying it's across the board.
Yeah,
so
sure.
the older you get, though, are there certain vaccines that maybe adults or seniors should be focused more on obtaining?
Well, let's just talk about influenza right now. Okay, this is flu season, and just last week, another 8 children died from influenza.
Oh, wow.
And when you look at the kids who die from influenza, about 80% of them did not receive the vaccine.
Yeah.
And so to us, again, this is a perfect opportunity to protect your child against a disease that we could potentially prevent. Unfortunately, I get it. I have a little bit of a different perspective from these diseases because I see the worst of the worst. But I've seen perfectly healthy, beautiful teenagers contract influenza and pass away. And this, to me, is just one of the most, it's such an awful consequence to something that maybe if we get more listening, more discussion, we can talk about the why of how it's important. But that's just one example, is influenza, which recently was taken off of a recommended list from the CDC be. And that is going to cause a lot of confusion and questions from parents. Why did they take it off? Did they find it's not safe? Did they find it doesn't work? And the answer is there was no new data that suggested reason why to take that off. And we want to be there to kind of talk through that with families so that they understand the why.
It just seems a matter of opinion.
Yeah.
Right,
with nothing to back it up. And so that's why this PSA is so important, right, Connie, to bring just that information and just education.
That education, that community education. And when we have healthy kids and we have a healthy community, we all thrive. When kids are in school, when they're going to class and they're not sick, they become those productive, successful citizens that we want. And when parents can go to work, they're being productive. So getting vaccinated and protecting each other, it's a community process. When one person gets a vaccine, it protects the person that they're working with, where they're going to school with. It protects the whole community. And we have a much healthier community as a whole. So it's just that public message. Get those questions. If you have questions, talk to a doctor. This is so important. Don't take it lightly if you're confused. Just reach out. We have resources at SuperShot. The doctors want to answer those questions. This is a community-wide campaign. It's every health systems. It's the main pediatric offices. It's the health department. It's SuperShot. Trying to speak as one voice. Ask those questions. We want to have a healthy community. Yeah.
So good. The last thing I'll ask Dr. Tony is just, I know what's on a lot of people's minds, of course, is as we're moving, it seems so close and far away from COVID, right? And so it's like people were so used to getting their COVID vaccine and then booster shots. Are booster shots still a thing with COVID?
Well, we are definitely still watching COVID strands and seeing if there are opportunities to protect against COVID, and specifically for the ones that are most at risk for some of the harmful consequences of COVID. Luckily, we are not in the same situation where our hospitals were flooded with adults that were dying from this disease, and we needed a big community effort to try to drive coronavirus down as low as possible. And so at this point, we can now, feel comfortable that certain populations probably are at more risk than others, and we can recommend that vaccine for. But for other children, while we're not in this big coronavirus surge, we can feel more comfortable and using more, informed consent, of course, always, but also shared decision making.
Okay, that's good. So just something to explore, and that's why it's important to come in. You can look at your options, see if it matches your medical record, and just kind of go from there. And you all have 3 locations around Fort Wayne?
Yeah, so our main clinic is at 1515 Hobson Road. So we're there 5 days a week, evening hours, Saturday hours. And then we also partner with Fort Wayne Community Schools, and we're down at their Family and Community Engagement Center Monday through Friday. And then we go up on Mondays to Grable Missionary Church and have a clinic up in Grable on Mondays.
Okay, wonderful. Well, thank you both so much for coming and sharing this information and your knowledge. It was very informative.
Oh, it was a pleasure.
Thank you for having us.
Thank you. And if you would like more information about SuperShot, we'll have their website listed below. And let's go ahead and close out by taking a look at the PSA.
Dear parents, from the moment your child was born,
we've seen the joy and the responsibility in your eyes.
We've been there with you, helping you through everyday worries.
Car seats, baby monitors, fevers.
And now, one choice feels heavier than ever.
vaccines.
Vaccines.
Many parents choose them with confidence.
Others pause, and we understand why.
Misinformation spreads faster than ever.
From viral posts to celebrity claims that sound convincing,
but aren't rooted in science.
As your local doctors, we want one thing.
For your child to grow up healthy.
And through all the noise, one truth remains.
Immunizations help keep your child safe.
We've read the research and understand the science.
More importantly, we know you.
We've cared for your children in the ER.
At your pediatric offices.
At school visits and community events.
we've always had your back.
We're your neighbors,
Your doctors.
Right here in Fort Wayne.
This segment sponsored by SuperShot.